Yeah, in the waiting room.
Great,
Yes.
thanks.
Yep. Okay. Looks like everybody's getting in. And I allowed everyone permission to record if you need to record, media members. Okay, if we're ready, then we are
Recording in
going live on
progress.
YouTube in 5, 4.
Thanks for joining us. I'm Jonathan Modi with Oregon Health Authority External Relations. This is a media briefing to discuss today's West Coast Health Alliance announcement of updated vaccine recommendations and improved vaccine access. I will add a link to that governor's office announcement in this meeting's chat. With us to discuss the recommendations and vaccines in general are Dr. Dean Seidlinger, Health Officer and Epidemiologist at OHA's Public Health Division, and Dr. Elizabeth Powers, Family Medicine Physician and Local Public Health Officer at Winding Waters Clinic, a federally qualified health center in Wallowa County. Also in the virtual room to help answer questions is Rachel Prusak, Executive Director of Oregon State Board of Nursing, Nicole Krishnaswamy, Executive Director of the Oregon Medical Board, Gary Runyon, Executive Director of the Oregon Board of Pharmacy, and TK Keene, Acting Insurance Commissioner at the Department of Consumer and Business Services, Division of Financial Regulation. Just a few reminders. Please make sure to include your media affiliations so we know that you are media. If you are not media, please hop off and join the YouTube live stream that was in the advisory for this media briefing, and we have put that link in the chat for your convenience. If you want to ask a question, please use the raise your hand function to be added to the queue, and I'll open the floor in the order in which raised hands are received. Or drop a question in the chat and I'll ask it for you. Please mute your audio when you're not asking a question and when you're done asking a question. We will take one question at a time. If you have a follow-up question, we'll take it when everyone has had a chance to ask a question. And if you'd like a recording of this media briefing, the link for the YouTube live stream will become the link for the recording when the media briefing is complete. And with that, I'll turn it over to Dr. Seidlinger.
Thank you, Jonathan. Good afternoon. Thank you for joining us today. At the direction of Governor Tina Kotek, OHA worked across agencies and licensing boards to ensure people in Oregon can get vaccines ahead of respiratory virus season as easily and affordably as possible. We took these actions to implement the unified West Coast Health Alliance vaccine recommendations released earlier this morning that are backed up by healthcare organizations we trust. I want to acknowledge the uncertainty and anxiety many people in Oregon are feeling as we enter the 2025-2026 respiratory virus season. The news we are here to discuss ensures that Oregonians will have affordable access to vaccines that protect them from COVID, influenza, and RSV infection. Following recent federal policy decisions on vaccines, it's been difficult for all of us to make sense of the sudden shift from having readily reliable access to COVID-19 vaccines to wondering whether these vaccines would be available at all. I also want to acknowledge and ask for your patience, as many things are changing, and it may take time for providers and pharmacists to be ready to give you your vaccines. Earlier today, the governors of Oregon, California, Hawaii, and Washington jointly announced the West Coast Health Alliance's consensus 2025-26 respiratory virus immunization recommendations for COVID-19, influenza, and RSV vaccines. These recommendations acknowledge that immunization is safe, effective, and offers the best protection available against respiratory viruses. They also endorse broad access to immunizations for all who want them. The West Coast Health Alliance has adopted current federal recommendations for influenza vaccine and RSV immunizations. These are similar to last season with minor updates to RSV products. To arrive at COVID-19 recommendations, the Alliance relied on data regarding those at highest risk for severe outcomes, including children under 2, adults over 65, individuals with underlying medical conditions, the previously unvaccinated, those who live in congregate settings, and pregnant individuals. The Alliance also recommends that COVID-19 vaccines be available to all who choose protection, just as they have been in previous seasons. My colleagues across all 4 states in the Alliance have been working across state governments and with partners to identify and implement strategies needing to put these recommendations into effect. And I'm pleased that many of my state colleagues here in Oregon are joining us today. Recent federal actions have severely restricted access to COVID-19 vaccines in Oregon and across the country. To counter this, the Oregon Board of Pharmacy has changed its rules and protocols. Effective Wednesday, September 17th, pharmacists in Oregon will have the authority to continue to administer COVID-19 vaccines without a prescription. I'd like to touch briefly on the cost of vaccines. Traditionally, insurers have covered vaccines recommended by the Centers for Disease Control and Prevention's Advisory Committee on Immunization Practices, or ACIP. Unfortunately, the ACIP has become an unreliable source of vaccine recommendations. For this reason, OHA has worked with the Governor's Office, the Oregon Department of Consumer and Business Services, and OEB and PEB to maximize private insurer coverage for the COVID-19 vaccine. Medicaid and Medicare will continue to cover the cost of the updated COVID vaccines as they previously have. Oregon and its partners in the West Coast Health Alliance are committed to safeguarding scientific expertise in vaccine access and leading with clarity, science, and care so that individuals and families know their options and can access the protection they deserve. Finally, I'd like to discuss why it's so important that people have the choice to get vaccines this respiratory virus season. COVID-19 percent positivity has been slowly increasing since May and currently sits at 16.1% as of September 6th. This is consistent with a summer surge of COVID-19, a pattern that has been observed every year since the 2020-2021 season. This same pattern is occurring nationwide. I think most of us have recently been sick or know friends, family members, or coworkers who have been sick in recent weeks. Many of them likely had COVID. Fortunately, this increase in people testing positive for COVID-19 has resulted in only a relatively small increase in hospitalizations in Oregon and across the country. On August 25th, the CDC released its 2025-2026 respiratory disease season outlook, which predicts that the upcoming US fall and winter respiratory disease season will likely have a similar combined number of peak hospitalizations due to COVID, influenza, and RSV compared to last season. But as we say in public health, every respiratory virus season is a bad respiratory virus season. Concurrent increases in influenza, RSV, and COVID-19 activity can easily stretch hospital capacity across the state. Oregon has one of the nation's lowest hospital bed capacities per person in the country, but that's largely in part due to our state's ability to keep demand for those beds low, especially when people stay healthy by getting vaccinated and keeping themselves, their loved ones, and their neighbors safe and out of the hospital. So once again, I ask for people to have patience as many things are changing all at once. Check in with your provider or pharmacist about availability of vaccine, and know that if it's not available today, you should be able to access it over the coming days and weeks. Thank you. And now I'd like to turn it over to Dr. Powers for her remarks.
Thank you, Dr. Seidlinger. Hello, my name is Dr. Liz Powers, and I'm a family medicine physician at Winding Waters in Wallowa County, Oregon. And I'm here today to speak to the importance of these updated vaccine recommendations. COVID-19, influenza, and RSV are common viruses. I treat hundreds of patients with them every year. For many, these viruses cause mild to moderate infection, but for some, they result in hospitalization and, tragically, death. Vaccines are the most powerful tools we have in preventing severe respiratory infections. They are underutilized, and there's a lot of disinformation out there, making it harder for people to understand whether vaccines are safe and which vaccines are recommended. There are people in my community who should get an updated COVID-19 vaccine because they are more likely to get very sick with these viruses. These include young children, the elderly, and those with underlying medical conditions. I also agree with the West Coast Health Alliance recommendation that everyone who wants a COVID-19 vaccine should have access to one. I'm glad to be a part of this effort to ensure that people here in my community and across Oregon can get vaccinated.
Thank you, Dr. Powers. Jonathan, I think we're ready for questions.
Okay, thank you, Dr. Powers. Thank you, Dr. Seidlinger. Just as a reminder, if you want to ask a question, please use the raise your hand function. You can find that at the react button to be added to the queue, and I'll open the floor in the order in which raised hands are received. Or you can drop a question in the chat and I'll ask it for you. Amelia Templeton with OPB. Go ahead.
Yeah, thanks. Hi, Dr. Seidlinger. I wanted to ask if there's any difference in the recommendations in these guidelines that specific groups be vaccinated. So, like an explicit recommendation that adults, say over 65, be vaccinated, and then the broad statement that anyone who wants the vaccine should be vaccinated. Is that something that clinicians are going to read differently, or is there sort of a different meaning there in those two categories?
Thank you, Amelia. I'll take those two parts separately. I think one of the principles in the West Coast Health Alliance, and something Governor Kotek and her colleagues directed us to do, is to follow the science and the data and make recommendations based on that, and to keep vaccines accessible. So we know that since vaccines became available at the end of 2020, they ramped up and became available to anyone 6 months and older who wanted one. And we know that many people, including parents of healthy children and healthy adults, chose to get a vaccine. And we think this is important because even people without underlying conditions who aren't the youngest and oldest individuals can still get COVID, can still become quite ill with COVID, and tragically have died from COVID. Plus, individuals often make choices about getting vaccinated to protect their family and loved ones and those closest to them. So we want to make sure that anyone who chooses to get a vaccine can get one and not have to say they have an underlying condition or be in one of the risk groups. That being said, we know that there are many people at higher risk for complications and that wind up in the hospital at much higher rates. So we recommend people from those groups get vaccinated. Quite simply, that's the youngest people in Oregon, those 6 months to 23 months, who have the second highest hospitalization rate behind our oldest Oregonians. We recommend that individuals 65 and older get vaccinated, as they have the highest hospitalization rates in Oregon. Other children over 2 and over, and adults under 65 who have an underlying condition that puts them at higher risk for COVID, such as being immunocompromised or having a medical condition that puts them at risk for complications, should get vaccinated for COVID. Individuals with higher exposures, so people who live in a congregate setting, people who work in a setting like healthcare, where they're exposed to individuals with COVID all the time, should get vaccinated. So those individuals, again, at the highest risk, and individuals who live with people at high risk should get vaccinated. But everyone else can choose to get vaccinated if they want, and they can do so in the same way they did last year.
Thanks, Amelia. We did get a couple questions, or a few questions in the chat. Amanda Bloom, I will take your questions one at a time, so I'll share the first one. Why not follow Washington's model and authorize pharmacists to immunize children over 2 years? The guidance offered leaves a huge hole for parents who are struggling to find PEDS doses. Pharmacists can only vaccinate kids over 7 right now.
Let me start with an answer, and then I'll turn it over to our Board of Pharmacy colleagues. Each state in the Alliance has agreed upon some consensus recommendations on who who we recommend for protection, and keeping vaccine access open to all. But each of us work within our own rules and regulations to implement those activities. So we took action based on conversations with our colleagues, the Department of Justice and the governor's office to do what's best to try and maintain access for vaccines in Oregon. In Oregon, that made sense to partner with the Board of Pharmacy so they could look at the rules and protocols and keep vaccine accessible as it was in years past. What that change did was mean that because the Advisory Committee on Immunization Practices, which covers liability for those youngest kids being vaccinated by pharmacists, hasn't been made yet, that the rules only cover what they can by law, kids 7 and up. We looked at the data and saw that it was about 1,000 children who received their COVID vaccine who were 3 to 6 years old last year in pharmacies. And we think that in working with our other healthcare providers, that we can vaccinate those kids in existing settings, and that pharmacists can continue to concentrate on those 7 and up. Is there anything you'd like to add from the Board of Pharmacy?
Hello, it's Gary Runyon, Executive Director for the Oregon Board of Pharmacy. Dean, I think you aptly summed it up there. What I'll note is, just to put that statistic into context, we have around 700 retail drug outlets currently registered in Oregon. So if we extrapolate that out over the course of the 23 to 24 COVID season, and the roughly 1,000 plus vaccines that Dean just mentioned would be roughly about 1.5 pediatric vaccinations per year per store or per registered retail drug outlet. So that equates to a really low, I don't want to say insignificant, but a really low uptake. And so it may make sense to allow those vaccines to be distributed elsewhere where the uptake is higher. But if we contextualize it that way, that it's a really significantly low uptake for vaccines for that age range at retail pharmacies.
Thank you, Director Runyon. And also, to put that number in perspective, I want to thank publicly pharmacists for their tremendous job in vaccinating individuals. About half of the COVID vaccines given last year, or close to 1 million of the doses that were given last year in Oregon, were given by pharmacists. But those pharmacists aren't vaccinating the youngest kids day in and day out. They're really vaccinating the rest of the population, and they'll continue to be able to do that.
Hey, thanks, Amanda, for the question. We'll get to your other questions later. Next question is from Shant with Oregon Capital Chronicle. Go ahead, Shant.
Thanks,
Yeah,
Jonathan.
thanks.
Just a bit of a two-parter here. Can you talk about like what statistical or factors you're tracking in terms of seeing the efficacy of making sure the COVID vaccine is given to people? And what timeline or deadlines have you set in terms of when you're hoping to see that people aren't experiencing these access issues before? I know you said days, weeks. Do you have a day for us?
Thanks for that. I think when you're talking about effectiveness, you mean how effective are we at communicating with people to get vaccines? I will say myself, my professional board colleagues on the phone are communicating actively with licensees, with our healthcare partners and others to encourage them to order and stock vaccine, to message their patients and clients about the importance of those vaccines, and to vaccinate at every opportunity they have when they see people. That said, the uptick of COVID-19 and flu vaccines are significantly lower than I would like in public health. So we continue to get the word out, remind people of the protection it provides. As far as a specific day, I don't want to get into that. But these rules by the Board of Pharmacy were filed today, and they become effective immediately. But for each pharmacist and the place that they work, they're going to need to take those protocols and assess, do they have the rules and the procedures and things in place? So different places will operate a little differently in getting that up to speed. While many pharmacists and many providers have COVID-19, flu, and RSV vaccines in stock, some have not ordered as much as they would have in the past because of the mixed messages that are coming out from our federal government, really curtailing access to now Oregon and our fellow West Coast states talking about expanded access. So there may need to be some time for not just pharmacists, but other providers to order vaccine and receive that to give to their patients. So that's why I ask, check in, check websites to see if vaccines are available, and don't just kind of show up tomorrow because that vaccine may not be available. But supply from our manufacturers should not be a constraint. So we think that it will take just a matter of days and into next week before we hit a regular rhythm of people being able to get their vaccine.
Thanks, Shant. Carol Morton in the chat, science writer Carol Morton asks, you mentioned vaccines for COVID-19, flu, and RSV. Are you making recommendations or taking action on childhood vaccines?
At this time, our focus has been on the respiratory season vaccines. We did this because respiratory season is going to be upon us before we know it. As I stated in my opening remarks, COVID-19 is here. We're in a summer wave that we've seen every year for the past few years. And our federal government really has not taken action on the COVID-19 vaccine. So people were left kind of rudderless without that piece. So we took action on these because it was urgent. We currently have a vaccine schedule that has been approved by the federal government that was based on science and data and informed in that sense. It aligns very well with the American Academy of Pediatrics recently released childhood vaccine schedule. And I want to remind folks that the American Academy of Pediatrics has been putting out childhood vaccines since before the Centers for Disease Control and Prevention did it. So right now we have two not conflicting schedules for childhood vaccinations. And so we think there's minimal confusion there. Do we have to combat misinformation and disinformation? Absolutely. But the schedules themselves rely on data and science and are aligned. I think we continue to watch actions taken by the Advisory Committee on Immunization Practices and the CDC and the FDA. And as those changes are made, if any changes are made, we'll examine them. We'll talk about them in the West Coast Health Alliance. And again, look towards evidence-based vaccine recommendations and promote that to our states, all the people living in our states, and to the providers who are vaccinating them.
Thanks for that question, Carol. Next question is from Catherine Cook of KGW. She says in the chat, you said it will take patience for today's recommendations to kick in. What's a more realistic timeline for when people not over 65, no health conditions, can get vaccinated?
Again, I truly think that is days. And by days, I mean, towards the end of this week and into the beginning of next week. Whenever there's a change, it can take some time. It took some time for the 4 Western states to get together, review data, come to consensus, some time to work across state agencies and boards to come up with a plan that would maximize access to vaccines and try and maintain payment for those vaccines across as many populations as possible. But now each organization that's providing vaccinations needs to take those and adapt them to their own site. Make sure they have vaccine available, that they have a way to make an appointment or a way to accommodate walk-in folks if they do that they have the staff available to give those vaccines. And so, I don't want to speak for every organization, but it will take, days and maybe into next week. And so that's why some patience is probably needed, checking on a website, or I will say if you're a provider hearing this, think about pushing out a message, posting an updated message on your website about how to access vaccine at your site, and that'll prevent unnecessary calls or emails from your patients and the people you serve, and provide them the best service that they deserve.
Thanks for that question, Catherine. Amelia with OPB has a follow-up question. Go ahead, Amelia.
Thanks. KFF Health News is reporting that ACIP is planning to change the childhood vaccine schedule for the Hep B vaccine. That vaccine is on their meeting agenda for tomorrow. What happens in Oregon if ACIP does pursue that vote tomorrow?
Thanks, Amelia. So if the Advisory Committee on Immunization Practices tomorrow takes action that changes current recommendations about the hepatitis B vaccine, or any other vaccine that's on their agenda, we'll examine the data and the science and the rationale behind their decision to look to see if that aligns and supports any changes they made. And if not, we'll look at the data on who's at risk, the data on the safety and efficacy of that vaccine, and we may come together with our West Coast Health Alliance partners to issue guidance that differs from the ACIP and CDC. I hope, though I think this is becoming more fleeting, that the ACIP members will look at the volumes of data we have on these safe and effective vaccines, the real world experience we've had. When you mentioned hepatitis B rates have plummeted since universal vaccination has started. And let me remind you that hepatitis B causes cancer. So let me be clear. If the hepatitis B vaccine is changed to something without underlying data, we likely won't adopt it, and we'll be going with a different recommendation based on the science and what the data is showing us.
Thanks, Amelia. Amanda Bloom has another question in the chat. Where should uninsured Oregonians go to get vaccinated?
For uninsured Oregonians, we ask that they can check with their local community health center, including federally qualified health centers, or a local health department to see if vaccine is available and what, if any, costs there will be for them to get vaccinated. Again, many organizations post this information on their website if people have access to a website, or they can be called to see if they have a vaccine.
Thanks, Amanda, for that question. I'm not seeing any other raised hands, so I'll go ahead and ask Amanda's other question. Why not simply state, quote, everyone over 6 months or older may receive a vaccine, end quote, instead of the bullets in the new guidance, which can leave wiggle room for pharmacists to deny vaccines to those who request without self-attestation?
So thank you. Let me go through the rationale and go through what they say, because I don't think there's any ambiguity there. When we make recommendations about who should be vaccinated, that was based on looking at the data on who's most impacted, whether the vaccines work, and are they safe. So I'll give you the age-based recommendations again, just because they're very clear. We know that people over 65 have the highest rate of hospitalization from COVID-19. That serious disease can be prevented almost across the board with vaccination. So that's why we recommend that everyone 65 and older should be vaccinated. The second highest rate of hospitalization for COVID-19 is kids under 2. So that's why we recommend that everyone 6 months to 23 months be vaccinated against COVID-19 to prevent them from getting severe disease and getting hospitalized. Similar data exists for those underlying health conditions for people who are immunocompromised. So we want to say that you should get vaccinated if you're most at risk. For other people, like a healthy child or a healthy adult, the risk may not be as high. But included in our who should get vaccinated is anyone who desires protection from a COVID-19 vaccine. So we're not going to ask you your reason. We're going to not ask you if you're doing it because you're worried about getting COVID yourself and potentially missing school or missing work. We're not going to ask you if you're getting this vaccine because you live with your grandparent who has, chronic lung disease and uses oxygen. We're not going to ask this because you're taking action to protect your spouse who's being treated for a rheumatological condition and they're immunocompromised. We're not going to ask you if you're getting this vaccine because you just want to take action to protect the coworkers that you spend 8 hours of your day with in an office. If you are choosing protection, that's reason enough to be able to get it. And so that's why that's included there. And I ask that all of our healthcare partners continue to offer that vaccine for people who show up to get it who are 6 months and up. And that if you have, a patient in front of you who's at a higher risk group, that you talk to them about why they should be vaccinated. Answer their questions so that they can choose protection for themselves.
Thanks for that question, Amanda. Amelia with OPB has a follow-up question. Go ahead, Amelia.
Yeah, I guess I'm wondering if the cost benefit, have you looked at the sort of cost benefit analysis for the higher risk groups versus the people who are in this kind of catch-all. Like, we understand there's lots of important, legitimate reasons people might want to get the vaccine. Are you still confident that any of the rare but real potential side effects of the vaccines are outweighed by the individual benefit to those people, healthy people from 6 months to 64 who are uh, in that, these people can get the shot if they want it group.
Thanks, Amelia. Let me reiterate that COVID-19 vaccines are extremely safe and they are effective, and they are especially effective at preventing severe disease and death. Why do I say vaccines are safe? They were studied extensively before release. They've been given to tens and hundreds of millions of people across the country. And in most countries, the safety of vaccines is continued to be studied after we use them. So we didn't release COVID vaccines at the end of 2020 and into 2021 and just say they're safe and effective, we're not going to look anymore. There's a system called VAERS, or the Vaccine Adverse Event Reporting System, that is just designed to be an early warning, kind of cast a wide net to look for complications. Anyone can report a complication, whether you think it's associated with the vaccine or not, whether you're the provider or not. And that just puts that on our radar screen to look, hey, is this association because of the vaccine? During that whole entire process, as we looked at risk factors, we identified a couple. If folks can remember, there was a Johnson & Johnson vaccine that was used fairly early on in the pandemic. There was a very rare and tragically serious complication of blood clots in the brain that was identified on these safety warning systems quickly. And that vaccine, those associations were examined. It was found to be likely as a cause of the vaccine, and that vaccine was withdrawn from the market. We also saw a slight increase in myocarditis, or inflammation around the heart muscle. This was particularly prominent in adolescent boys and young men, and particularly prominent after the first dose of vaccine. But many people don't complete that story. What the research and the data also shows us is that there's an even higher risk of myocarditis, or inflammation of the heart, when you get COVID. And so the risk of myocarditis from COVID is actually much smaller than the risk of myocarditis, or from the COVID vaccine is much smaller than the risk of myocarditis from getting infected. And in the follow-up studies, look at those individuals, clinical symptoms are often not seen or resolved fairly quickly. And we don't see studies that show significant or any real lasting impact from that. So I think, a parent of an adolescent, or an older adolescent themselves who can consent for vaccines themselves, having that conversation about the incredible benefits of the vaccine, and yes, the rare but potential serious side effects is important, but it should be available to those who choose to get it. And that's what our recommendations do.
Thanks, Amelia. We'll take one more question. This question is in the chat, again from Amanda Bloom. Pharmacies are reporting trouble getting stock from suppliers all across Oregon. How is the Alliance influencing stock being shipped to fulfill Oregon orders?
Thank you. I'll have to say that this is an area that, unfortunately, Oregon Health Authority and my colleagues in the health departments in other states don't have as much visibility in or influence on. Vaccinations are distributed by manufacturers and distributors directly to providers, including pharmacies, for the patients and the clients they serve, for any vaccine that's paid for in the private market. And so OHA is not the middle person there. And so some pharmacists, some providers have been reluctant to order vaccine, and I think others, it's coming in as it does at the beginning of every season, in blocks, with more vaccines being shipped every week or every 2 weeks, depending on the supplier, the manufacturer, in a cadence that tries to get vaccines spread widely, and to try and meet demand across various countries or across various states. What I will say is that for folks who are on, for children who are on Medicaid, so these are children whose vaccines are purchased in bulk by the state and distributed to providers through a program called Vaccines for Children. That ordering is not yet available for us in Oregon or any other state because it is dependent on the federal government taking action. It is dependent on the Advisory Committee on Immunization Practices making a recommendation for that vaccine to be available for federal law to open up ordering. So I call on our federal partners, to take action to make that vaccine available. So that states like Oregon and fellow alliance states can receive vaccine. And if there's anyone on there from a vaccine manufacturer or distributor, I think you can send more vaccine to Oregon, to our neighbors in California and Washington and in Hawaii, because we want to ensure that vaccine access for anyone who wants it is available, and that those who are most vulnerable get vaccinated against the flu, against COVID-19, and against RSV. These are steps we can all take to protect ourselves and our loved ones, and really our broader community.
Thank you for that question, Amanda. And with that, we'll wrap this up. I just want to say thanks to Dr. Seidlinger, Dr. Powers, Rachel Prusak, Nicole Krishnaswamy, Gary Runyon, and TK Keene for participating in this media briefing. If you have any other questions, please email phd.communications@oha.oregon.gov. I put that in the chat, and I also put in the chat the link to the governor's West Coast Health Alliance vaccine recommendations announcement from today. Thank you very much and have a great rest of your evening.
Recording stopped.
Thanks, everybody. I want to go ahead and end the meeting. Appreciate everybody showing up.
Thanks,
Thank you for
everyone, for your
organizing.
time.
Thank you all for participating. Appreciate it. Let me know if you have any questions or anything at all. Great to see you all.
Thank you.
Thank you.
Good job,
Take
Dean.
care.